everything about it was unexpected. All of the preparations, all of the knowledge, all of the classes, all of the booklets didn't describe anything about what it was going to be like in real life,
Mm-hmm.
hour day by day.
Mm-hmm.
And it's rough.
Yeah.
It's really rough.
It's a tough recovery.
It's really tough.
Let's talk knees, titanium knees. From hurting to healing to taking the lead. Let's talk knees.
Welcome, Gail. Thank you so much for being here. We really appreciate you spending your part of your afternoon with us today. So tell us a little bit about yourself and how you came to even need total knee replacement.
This wasn't planned necessarily. So a little bit about me. I'm retired, and in retirement, I discovered pickleball. So I became an avid pickleball player. Love it. Play 5 to 6 days a week, a couple hours a day. Love it, love it, love it. So, and it's August now. In February of this year, I was having trouble with my knee. And I thought, you know what, I'm just going to sit out for a while. The weather was bad. It was cold. I thought, I'm just going to sit out for a while and just go to the gym and not play pickleball. And I was having trouble walking. So, I'm a big walker, and I couldn't go a distance and depend on myself to get back. I could only go half the distance so I could get back home and not have to call somebody to come get me.
Wow.
So my rate of walking had really decreased as well because of the pain in my knee. So I made an appointment to see my ortho. Made an appointment, couldn't get in with him, got in with somebody else in the practice, which was fine. Went in like on a Tuesday, and he did an MRI, and he said couldn't give me the results of the MRI that day. So I made an appointment to go back Friday of that same week. So that's good. Wednesday, I was just out shopping, going into a store, took a step up onto the curb, and there was a pop snap and the back of my knee. And I pulled the meniscus at the root of my meniscus. I was immobilized. I couldn't move. So I was just stuck there on the sidewalk. I was waving my arms trying to get the door, the store to open, but I wasn't close enough to get it to open. Finally, somebody came out, and I was blocking the entrance, and I couldn't move. And looked at me. She said, "Are you okay?" I said, "No." So she wanted to know if she could help me to my car. I said, "No, but could you bring my car to me?" And I just gave her the keys, and she brought my car to me. Yeah, I went home and ended up couldn't get out of the car. My neighbors had to get me.
Oh my word!
It was a bizarre scene, y'all. It was a bizarre. Yeah, I couldn't put any weight. I couldn't put my toe on the ground. It was just so painful. But they got me into the house, did all kinds of stuff. Got one of my sons over here, took me up to the hospital, and all they did was an X-ray. They don't do MRIs at that hospital late at night and all that. So they just did an X-ray and gave me meloxicam, and now I'm in a wheelchair.
Oof.
So went back to the ortho for my Friday follow-up appointment for the MRI in a wheelchair.
Wow.
He's like, well,
and he's thinking, well, you're being a little dramatic, aren't you?
Right. Dramatic. Are you begging for surgery or what? So what he did, he did not call for another MRI. He gave me a steroid shot and a prescription for 6 weeks of physical therapy. So the steroid shot really helped. So by Saturday, I could put my foot down a little bit. By Sunday, with crutches, I could do a little bit of weight bearing. And then the rest of the week, I was on crutches. And I had to call for my brother out of state to come help me. Wow. Because it was a big deal. So anyway, got through all that, did all the physical therapy, and I had a follow-up appointment with the ortho. So I went into a follow-up appointment. At that time, he did the second MRI. Looking at the second MRI, the results of that are that there were significant changes between the one in February and the one in March or April, whenever it was. So he said, based on this, I don't do knee and hip surgery. He does some other surgeries. He said, I'm going to refer you to one of the other doctors in our practice. And he did, and he's a guy who's a specialist in knee replacements. So I met with him. They pulled up all of my pictures, explained what was going on, and I had quite a few things going on in the knee. I had no cartilage. I had, I had a meniscus, a small meniscus here in one area, but I had the torn meniscus at the root, and they can't do anything really about that.
Oh.
I had a small fracture, and I have arthritis. So they are not going to tell you what to do, but they can make a recommendation. But in our course of treatment, you can stay as you are, or you're a good candidate for total knee replacement surgery. So, I sat with that for a while and thought about it and thought, well, and then they said, the thing is, we can't do surgery. There has to be a 3-month waiting period between when you have the steroid shot and when we can do surgery.
Oh, that's right.
So, yes. So I took the first available date after the 3-month mark, which was May. So that's how I landed in it.
How was that?
I guess it was fortuitous that I went to the doctor because I was having some pain and some issues, and I was concerned about something happening. But boy, when that meniscus tears at the root, it's you hear it. It's a snap and a pop, and you feel it. So that's what happened. So I decided, yeah, I'm going to do it.
And when that meniscus tore at the root, I mean, it was just from stepping up on a curb. I mean, but did the doctor say, was it because it was worn down, it was damaged and whatnot? Or, I mean, what would cause it to do that?
That's a good question, and I don't know. The same thing happened on my left knee 3 years ago. I was just walking across the office, and I took a step, and again, snap, pop, and I would have fallen, but I caught myself on a table, and it was the same thing. I was across the street from the hospital, but I couldn't get there.
And what did you do about that knee?
That was during COVID.
Uh-huh.
So this is considered an elective surgery.
Right.
I had to wait. So I went to the hospital. They put me in a brace. But that was a completely different experience. So I went to the orthopedist, the same one I tried to get into in February, but he was booked. And he ordered physical therapy. He was really keen on waiting, but plus we had that COVID thing going on. And so I did more physical therapy then, and he fit me in a huge brace. I don't know if you've seen those braces that, they come
The
up.
offloading kind?
It is an offloader, and then, they order it, they measure it specifically for your knee, and somebody comes to the house and sets it. And he said, your choices are, you can wear this brace for the rest of your life. You can play pickleball in it, but whenever you get out of the house, I want you in this brace. Or we can do something to kind of, clean that up. So I just went in and, when things opened up again, so it was probably March, I went in and had just a surgery where they trim off all the torn edges. They don't do anything else. It's not a repair.
It's like arthroscopic or something like that?
Yes, and they're just trimming.
I've heard of that.
Damaged pieces. So you're still kind
helped.
of, yeah. So it took me a while to heal from that to the point where I could get back to pickleball and active living. But I mean, there was no pain. I had a person spend one night with me, then I sent her home. It's like, I got crutches, I'm fine. It was my left leg, I could drive. I mean, I was self-sufficient, I was happy. I pretty much carry on. It was just with crutches.
Yeah.
So yeah, the same thing happened. I don't know why it happens, I guess.
Yeah. Interesting. That's very interesting. Wow.
I'm going to quit walking.
Right. I'm just going to sit here. I'm not getting up.
I don't need that.
Wow.
And my brothers and sisters don't have this issue. So I don't know. I'm a special one.
Huh. That's very interesting.
pickleball, I'm going to add one thing, but in my pickleball group, and they're of my age, it's so many people in there have, been in sports their whole life or they're active. There have been a lot of people who have something's gone wrong. They've had some sort of surgery. They've had shoulder surgery or wrist surgery or hip replacement or knee replacement or their feet are bad. So it's, within the population that this isn't unusual. A lot of people are going in to have some orthopedic issue addressed. So it's a little bit commonplace. So when it came my turn, I'm thinking, okay, they're all out here playing pickleball. They're going and playing softball and they're doing whatever. I guess it's my turn.
Yeah.
Yeah.
Very good. So how did you feel? How did you feel right after you had the surgery about having had your turn? Do you wish you would have waited on your turn? Maybe just pass to the next person?
I hold on to that for a minute and kind of talk about the pre-op stuff,
Okay.
my preparation for it.
Sure.
Yeah, because I don't know what other people's experiences were, but I really feel that with the surgeon that I was working with and the team and the way that they managed the pre-operative session was good. I had a lot of information. They offered surgery classes. They really recommend that their patients go to a surgery class. It's led by a physical therapist. There's time for a question and answer. They're going through a PowerPoint. It's really covering, what to expect from the point on the day when you arrive. You're going to be parking here. You're going to be arriving here. You take this escalator. You go up there. Everything's laid out, what's going to happen, the meds you're going to have. And then you're given that same handout to take home. So you have all this information, the equipment you're going to need, recommended diet. And then they also give you another 20-page booklet on just more information about what it's like, when to call 911, when to call the doctor, your beginning exercises, showing you illustrations and step-by-step instructions on how to do them. So I had all that. I had changed my diet, so I no alcohol, no sugar. Going into this for a couple months, I just thought I'm going to go in, want to be healthy as I can be. I haven't had the meniscus surgery before. I knew that when you're on crutches or using a walker, you can't use your hands to carry things. So I went to Walmart and Target and I bought dresses that had really deep pockets so I could stuff everything in my pockets. It's like, I'm not going to have my hands. I got to carry stuff on my body.
That's a great idea.
Yeah. So it was, and get them on sale like $13. And, I went out, I shopped in bulk because I thought, well, I need to have things in the house so that if I can't carry them, I have steps on the front and the back. I have 3 steps going into the house that if I can't carry them, so I stocked up on toilet paper and paper towels and, shampoos, just so I wouldn't have to go out and do errands and that I wouldn't have to carry things in.
So I'm assuming you live alone then? There's nobody there to help you? Okay.
Yeah. So I wanted, all these things in place.
Sure.
Bought all my boots, had all my comfort boots, food in the freezer, graham crackers and peanut butter, all the things I like. Went and got my hair colored. They couldn't cut it, so it's just gone, got awful long right now. But eventually I'll be able to get it cut. So I was ready. I felt, I've been to my surgery class. I understand what's going to happen. No people have been through this. I'm ready.
Good.
And what else? Oh, and there's so many people that I talked to. Oh, it's the best decision I ever made. Having that knee surgery is the best decision I've ever made. I've never seen anybody immediately after their surgery. I've seen them 2 years after their surgery.
Right. And I think they forget a little bit. Yeah.
Yes.
I'm pretty sure that they forget, kind of like having a baby, they forget what that was like. Because I do know a couple of people that are, over a couple of years out, and they were the same way. It's like, oh, it was
I wish
great.
I'd done it 5 years
Yeah,
sooner.
it was great. And
Right.
now that I'm 6 months into it, when I talk to them, and I just talked to one of them yesterday, then she's telling me things like, oh, I'm still struggling with stairs, and boy, I sure wasn't doing that at 6 months, and and I'm like, oh, interesting, because before you made it sound like this was super
It's a
easy for you.
breeze.
That's
So
the case. Yeah.
yeah.
But stairs. I don't take the elevator anymore.
Right?
um, so my expectations were that I was going to be kind of awake and alert and able to do some things, read a book. And one of my sons was coming to take care of me and stay with me for 2 weeks.
Oh, good.
Yeah, he had a project that he was working on with some spreadsheets and stuff. And I thought, I'll probably be able to help with that because I can do that. And I just sit here and, figured he'd be able to get about 6 hours of work done a day. Those were our expectations.
How'd that work out?
Yeah, it was nothing like that.
Well, at least you were prepared with the food and supplies, right? You got that.
I just talked to my son a little while ago. He said the first 2 days I was pretty, in a good mood, pretty hyped up about it. And it was, kind of okay.
Is that because in the first couple of days, because you still were under the influence of the spinal?
Right.
I sure think so.
Yeah.
Pain blockers.
Yeah.
That's-
Yeah, for sure. For sure.
I think one of the things with what kind of surgery and even the anesthesia, I had 3 different types of anesthesia. So for my doctor, he doesn't, particularly, he said really with anybody over the age of 60 and anybody who has any cognitive issues like Alzheimer's, dementia, he doesn't want to put them completely under because they have too much of a difficult time waking up. So
Okay.
I had 3 different types of anesthesia. I was in a twilight, and he told me, we're going to be able to talk. I said, I don't want to talk to you during surgery.
Right?
You concentrate on that.
I don't want to be present for that.
Right.
But we did not chat during surgery. So I was in a twilight, and I had a spinal block, and then I had a number of local injections in the knee.
Ah.
So it was 3 different approaches for the anesthesia.
But you don't remember anything about the surgery, right? You weren't aware at all, or were you?
No. Nope, I've got a picture of me before I went in, got my little cap on, got my gown on. Ready
Happy
to
as
go.
can be.
Yeah, anesthesiologist came in and said, I'm going to start a line. I said, okay. I didn't make it out. They didn't roll me out past the curtains before I was gone.
Yeah. Yeah.
I never saw the operating room.
What was it like when you first woke up from surgery? Did you have any pain when you first woke up?
Honest to goodness, I don't remember that.
Okay.
I really don't. What I remember is that, and I knew this ahead of time, in order to go home that day, you had to pass 3 tests. So you had to walk 150 feet with your walker. You had to go up and down 3 stairs. And the third one, I don't remember what the third one was, but I wonder if it was transitioning like from a bed to a chair or a chair to the walker, doing some transition like that. And then you had to be able to be cognitively intact to be able to answer those questions of, presence of mind. What day is it? Where are you? What's your name? What did you do today? Why are you here?
Interesting.
Right. Okay.
Interesting.
Yeah, being okay, you're just overwhelmed. Like, I have to walk 150 feet and I have to climb stairs. But I did it and did it without any pain, Cindy. I don't remember any.
Yeah.
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 Just like, wow, look at me.
That's really good. That's really good.
At that point, she's like, "This is the best thing I've ever done. I'm so happy."
I
I
would
did
have done this 10 years ago.
Right.
I didn't have to do any stairs. They didn't
You
have
did
me
not
do
do
any
stairs.
stairs. All they
You
had
had
me
to
do
walk.
was walk, and I had to be able to go to the bathroom, go pee.
Yeah, that was
Which that was probably the hardest thing, was waking that up.
Maybe, I think, you know what? I think you're right. I think that was the third element.
Yeah, it
Yeah.
probably was. I know that that's usually pretty important. And the reason I asked that question is because when I woke up, my first memory waking up from surgery was the horrific pain I felt in my knee. And it terrified me because I'd never woken up from a surgery feeling pain. And so I woke up moaning in pain, and they immediately got, pain meds on board, and then that calmed down. But I remember that scared me. That scared me. That was my first thought of, oh my gosh, what have I done?
The mistake.
Yeah, that was pretty terrifying. So did the pain meds then that you came home with, did those pain meds work well for you and keep your pain under control?
I did not think so. I don't think that I tolerated the pain medication well. And this is where things went wacky for me. And surgery was Wednesday, and I passed my test, so I was also discharged Wednesday. It was day surgery.
Right.
Surgery in the morning, and was home by early afternoon, early evening. It's Wednesday. It was Thursday and Friday. What I remember is I had no appetite for all my favorite foods. I didn't want to eat anything, no appetite. I really didn't want to drink anything. My son said he kept being sure that I was getting sips of water and stuff. By Saturday morning, I woke up, I was in a state of distress, and I hadn't slept. I hadn't slept since the surgery. No sleep Wednesday night, no sleep Thursday night, no sleep Friday night. A lot of pain, this increasing pain as everything's wearing off. Going kind of wacky with it was tramadol and oxycodone, alternating those like every 6 hours, I think. I didn't wake up because I had never been to sleep, but when my son got up, I was in a state of distress. My chest hurt. I was having a fever. I was just distressed. He called the on-call doctor. He said, you've got to take her to the emergency room. So I went in and I was admitted into the hospital.
Oh, wow.
I spent 3 days in the hospital. Yeah. I think that's unusual. I don't know why that happened. I asked the surgeon afterwards. He said sometimes people have a reaction to the anesthesia. Sometimes it's, there's no real clear-cut explanation as to why that happened. But I was dehydrated, and then all of my blood work was just upside down.
Wow.
I mean, it just wasn't, yeah. My sodium had bottomed out, my potassium had bottomed out, the glucose had skyrocketed, the thyroid had skyrocketed.
Goodness.
Yeah, all the red blood counts were down, the hemoglobin was trending down. They were at a point of deciding to, put me in rehab and do a blood transfusion.
Yeah.
I know. So it's like, one more unexpected thing, Cindy.
Right. They didn't tell me about this in the class.
Oh, they told me about that. So anyway, and then during that time, I was just in the bed. They couldn't even do physical therapy with me because I had that postural changes and blood pressure where if you're laying down and then sit up, raises, and then you go from sitting to standing, and it plummets. And so for whatever reason, my system was totally out of whack. So anyway, I get to go home on Monday, and then my story seems identical to yours.
Okay. Wow. What an experience with
Right?
all of that. Oh my goodness. Like you said, I mean, you can't prepare yourself for that. You had just absolutely no idea. And, it's one of those things where you wonder, is this something the way your body, like the doctor said, maybe it's the way your body reacted to anesthesia or who knows? I mean, but I'm sure it could happen to anybody. But that's terrible. And I'm glad you made it through that. Okay. So the next thing I'd like for you to talk about is your emotional state through all of this. And in the first few weeks, did you feel like you were on an emotional roller coaster? Was that a problem for you at all?
Cindy, I'm still on an emotional roller coaster, and I may cry at any time during this interview. It's okay. It just happens, and you guys just keep on going.
Yeah. Yeah.
It'll pass. Absolutely, totally unexpected for that. I think it's been one of the roughest rides physically and probably emotional that I've been on. It's very, very difficult. For some reason, all this tearfulness, I almost think it's like post-traumatic surgical stress disorder.
Yeah. I wonder that too, because I've talked to a lot of people that they say they've had spinal fusion and just all these other really major surgeries, and they never dealt with any emotional thing like they did with their knee. And it's very interesting. And it's interesting that, I mean, that probably wasn't in your class either, but because I just thought it was me. I just thought something's wrong with me. I just cried all the time. It was terrible. It was absolutely terrible. It was the worst. I would say the first month was the worst, and then it started to taper off. But
Another thing that I had, and this was maybe coming out of the hospital when I came back, so I'm still not a week out of surgery. I didn't want any sensory input. I mean, I was just like so absorbed with pain. I didn't want light. I didn't watch TV. I didn't videos on TV, on phone. I didn't want any music. I didn't want any sound. I was just overwhelmed. My body was just overwhelmed.
Yeah.
No more input. I'm doing everything I can just to do my exercises every day, crying through the exercises because they hurt.
Yep.
Did that sensory sensitivity, for lack of a better word, did that go to like touch also? Like if I know we talked with somebody who they couldn't stand to have their sheet anywhere near their knee because it just would drive them crazy.
Yeah. So I watched that actually. I had exactly the same thing. It was after they took the bandages off. So after they took the outer bandages off, and then they took the little strip of tape off.
Mm-hmm.
The knee still feels real funny because it's partially numb, partially awake, and it's just it's very, very sensitive. It would keep me awake at night. I even found online a thing called a blanket lifter.
Oh yeah, I've heard of that.
It's like a little tray that you put on top of your mattress, and then the sheets and blanket go over it, and it just raises it so that your feet just slip right underneath. And it's really for people who've had foot surgery. Lift it off the feet, but it'll keep it off of your knee also. I was able to figure out something using pillows, and that it lifted up and up. But yeah, couldn't stand it. Couldn't stand the touch. And up until about 3 nights ago, I still wrap it in an ace bandage at night, and I would recommend that for people because wrap the in an ace bandage loosely, applies a little bit of pressure, but it keeps the sensation of that rubbing.
Interesting. So you were not prescribed compression socks or compression hose after?
And that's something I wanted to ask about. I didn't have the continuous motion machine, and I didn't have compression socks, and I see a lot of people have that, and I'm wondering if different surgeons have different.
I know.
Aftercare.
And that's so interesting to me, and I can't help but wonder, with that sensitivity, even just the sensitivity on the incision, if the compression hose, do they exacerbate that? Do they make it worse, or do they help with that? I wonder, because I don't know. I bought myself some compression hose at probably about 7 or 8 weeks, I think, because I'd heard so many people, said that they really helped. It gave them relief and stuff. So I thought, well, I'm just going to try them. And I liked them. I liked the way and mine weren't super, super tight because I wanted to be able to get them on and off. But they really did help. Now, I might not have liked them in the beginning, but so I actually have 3 pair now because I wear them in the car, especially if I have to drive a distance, an hour or so, I'll wear them. But I don't have any more sensitivity.
Surgical compression socks that I think must come from their doctors, and I've had those before for other surgeries, and they go all the way up to your thigh.
Huh?
I mean, all the way up to your past the thigh. And my doctor didn't give me any, and I don't recall any instructions to use them, so I didn't.
Yeah.
Did you use the machine?
No.
Was that prescribed?
No, I hadn't even heard of it. I didn't even know what it was. I heard, I was on that forum and people were talking about it, and I didn't know what it was. And so I asked my physical therapist about it. I said, is that something I should be doing? And And he just said, not if your doctor didn't prescribe it. He said, because some doctors are fully against it and some doctors believe in it. He said, so it's just best to do, follow your surgeon's orders. And mine said no. Mine said, do your heel slides and pump your ankles.
Hate
And
them. I still hate the heel slides.
yeah, I still have issues when I do heel slides. It's fine, like when I wake up in the morning, I try to really, move my ankles and move my legs around and stuff before I get out of bed. But when I slide my heel in, that's fine. But when I slide my heel out, if I don't let it really push down into the bed, if I let it push down into the bed, it's fine. But if I kind of like help it and like lift it and put it out, oh, that doesn't feel good behind my kneecap. So, and I'm 6 months, so, I'm hoping that, it'll get better. I know it will get better.
Did they have you slides? When you're and your feet are up on the wall, and so you're sliding your
No.
foot down, like pushing it back up.
No.
So I do wall slides, and I can get down pretty far, but there are situations where I get stuck. So it's like I've got my knee down, but I cannot get it up.
Oh, wow.
And tears.
Do you is that where you put your other foot behind it then and kind of push it up?
They really want me to, use my quadriceps, but it hurts. The pain is in my kneecap.
Yeah.
It's either at my kneecap, it's either at the very base down here or up at the top. And it's just, it just brings a slew of cuss words with it,
And you're 10 weeks post-op, is that right?
I am.
10 weeks. So when I was having issues at around that time with my kneecap, I was doing a bunch of research and stuff. And then I even talked to the physical therapist one day, but they said a lot of times, a lot of that pain can come from the IT band, because the IT band runs down the outside of your thigh, comes down past the knee, and then kind of wraps around under the kneecap. And so if that IT band is really tight, then you've got that pulling against it, while you're trying to move it. So, maybe some IT band therapy, would help too. I don't know. It's so hard to know because there's just so many tendons and ligaments crissing and crossing and everything around there. And
It's a design flaw.
I
I want to speak to the manufacturer.
The first, 2 weeks, I had my son here. At the end of 2 weeks, he was leaving, and it's like I'm not ready to be alone. I can't handle it. I called one of my brothers to come down, and it's like, can you come back? He's the one who came down. February when I, tore the meniscus in the root and was in the wheelchair, and he did. He came down like the next day.
Nice.
It's like I can't be alone. But by that time, I was, I could get up and fix eggs, and I could wash the dishes. I was trying to do something to normalize my life and to have a little bit of normal activity. But because my life for the first 6 weeks was from the couch to the bed, to the couch, to the bed, to the couch, to the bed. And every now and then I'll walk outside and do my physical therapy twice a day. The emotional part of it, I just don't understand. I've never experienced anything like this, where I think it's just trauma. It's like trauma, and there's so much pain in your body. It's just like oozing out of my pores.
Yeah.
And I decided to just let it come. I'm not necessarily feeling bad, but maybe this is some cleansing thing.
Right. No, I think you're right too about it's a type of PTSD or something, because, I don't even think the doctors and the physical therapists can explain the emotional aspect of it. They see it, they know people go through it, but they don't really seem to know why, and they can't give you any answers for it, but it's real.
It is real.
It is absolutely real. And, as you get better, and as things feel better, and as you feel like you're starting to get, your life back and everything, it definitely gets better for me, because see, there it is. All I have to do is think about that time. If I remember those days, it hits me just like that. There it is. And
Yeah.
so, that's why I think, oh yeah, PTSD sounds like that fits. That tracks.
Say, Cindy, one of the things that really got me about, landing on you, I have done, just extensive deep dives into the internet, into YouTube, into videos, into physical therapists, into surgery, into all kinds of things. Watching you, you really did give an honest, what I thought was a really honest review, and I could see that in your face. And it's like that's what she is experiencing. I experience. I see that. I could see that the kind of that tearfulness or that stress come in.
Mm-hmm.
Me, even approaching this today, I was concerned. It's like, how am I going to get through this without crying? Because it just can come. It can just.
And that's okay if it does.
Yeah.
That's okay if it does. I mean, what we've been through is tough, and it might not be tough for everybody that goes through it, but that everybody heals differently, everybody recovers differently. And, it's our recovery. And I just think, it's okay. It's okay if we cry and get emotional. And like you said, it's, we need to release that. And it's probably better than holding it in and trying to tough it out, just let it go, I mean,
My brother-
I'm really glad that you had your son and your brother come and help you, because I don't know how people do this alone. And so many do. And not only just getting your food and getting your ice packs and, getting your medicine and stuff. I mean, yeah, there's that aspect of it. But for me, having somebody to tell me it's going to be okay, it's going to get better, you're going to get through it, because I was sure I was not. I was not going to get through this. I was not going to make it. And so, go ahead.
Last week, which was just a week ago today, last Saturday, at 9 weeks, I was there. It's just like I hit the wall, and it's like this. I could cry. This is so much bigger than I am.
Yeah.
It's too much. It's so much bigger than I am. How am I going to do this? How am I going to get through this? And one of the difficult things is to keep your own motivation up.
Yeah.
Because it hurts. If every time you're doing that leg and a string of cuss words comes out, it hurts.
Yeah.
It's hard to do. But yeah, and so after I just have that little breakdown, and it's like, well, okay, I guess I'll just get up and do my exercises again.
Yeah. How much PT are you doing right now? What's your PT routine?
My PT routine. There are a couple of things. When you're just having your surgery and you're the surgical patient for the knee replacement and you're going discharged and going home, you get in-home. There's physical therapy. So I had in-home physical therapy. Did you have that?
Mm-mm.
So, but I had a glitch. And so that was through one agency because I had a hospital admission.
No.
When you have a hospital admission and you're discharged from the hospital, then it went a different track. So now I'm, set up with one agency, but now he wanted me with this other physical therapist. It's more kind of choosing that physical therapist. So came home from the hospital, and I had in-home twice a week with that guy, and he was really good. Oh my God, he was so sweet. He was so patient.
Nice.
Come in, they have to take your temperature and your blood pressure every time. Physical therapy is in your bed, and you're doing the heel slides, the quad presses. You're just doing all of those beginning exercises. So he came twice a week, I guess for 2 weeks, and then he's the one who took the bandage off.
Oh.
So it's up to the physical therapist to take the bandage off. Then I was discharged from that and then transferred over to in-home with the other agency.
Oh.
So, and I had, I guess, 2 more weeks of in-home with 2 different therapists. One of them kind of talked a lot, and maybe did more explaining about things. The other one really worked with me and, worked with my leg and my, and, and then I was discharged to outpatient. And these guys have been amazing.
Oh, that's great.
Good.
Yeah, I'd say at the beginning, I maybe had a little bit of similar experience with you, and I thought, here I am in just in excruciating pain. It took everything I could get, to get in the car. My brother drive me up here, get out of the car, get in here, and then they put something on me, set the timer for 2 minutes, and walk away.
Yeah.
Yep.
Yeah. And I thought, well, is this how it's going to be? But the more I went, I started interacting more with them, and my mood was not good. I know I was not a pleasant person to be around.
Same.
I wasn't going and smiling and happy and, hey, how are you guys today? That wasn't me. I was, the same cheerful bucket I was at home. uh, they've just been amazing. They give me so much attention, so much specialized attention. They're really pointing out, this is what I want you to work. They've got my hands on my quads. Tighten this quad. Put your hand here. Feel this. You need to loosen up the hamstring. Let go of that. Keep that loose. Work this here. At about week 7, I think it was, there was one of the physical therapists in there. I hadn't met him, never had him. But when my session was over, he came over and he just started talking to me. How you doing? And I've been having a ton of trouble with my IT band and my hamstrings. And I was convinced that the surgeon had put a metal plate in my IT band because that's how hard it was.
Yeah.
I mean, it was hard. He came over and he said, do you mind if I just massage this a little bit? That began to turn things around. So 2 or 3 times he did, after the session, he would massage my IT band and my hamstrings, which were so painful.
Yeah.
Those 4 weeks, even now, I'm only able to be sitting in a chair. I couldn't put my arm on my quadricep. I couldn't put any pressure on my quadricep.
Wow.
Couldn't put any weight. Sitting in a chair, just having my leg come over the edge of the chair. I haven't been able to sit in a chair. I was on the couch with my legs out. He started just manual manipulation of my hamstrings and my IT band, and it has really, I think, made a difference.
Good.
Sub, I think, at that particular setting. So then my regular guy has started doing that, and he's working on the hamstrings a lot because I still have such tightness under my knee. Those 2 hamstrings come down and they connect under the knee. That's preventing me from getting bend. I can bend at the top. It's just like under here I can't. It's just tight. So they've both been doing just manual manipulation, and it's been great.
That's great. That's great.
Yeah.
That's something I never got at my physical therapy, which is why I just quit, because I could do better on my own with a physical therapist on YouTube than I could with them. So it sounds like, I mean, with your IT band and your hamstring, I mean, that could explain the issues that you're having under your kneecap with all that tightness. So hopefully as they get that loosened up, that will get better.
My knee. I feel like there's a big ball behind me. Oh, I also had a Baker's cyst.
Yep.
But, yeah.
Same.
But I feel like behind my knee is swollen, like about this big.
Yeah.
It isn't.
Right.
That's the sensation that I have, that it's so full, so tender, so swollen that I don't have the mobility that. But I think it's those hamstrings coming down and everything's so tight.
Mm-hmm. The hamstrings coming down, and then the calf muscle.
Yes.
I've had a lot of trouble. I mean, even like right now, I'm pulling my toes up. My calf muscle is just so tight. And that, the calf muscle and the hamstring, they both crisscross behind the knee. And so if they're tight, all they're doing is causing problems back there. So Yeah, it's just, people want to think it's just the knee. It's so much more than the knee. It goes from the glutes all the way down to the ankle, you know.
So did you have bruising?
Yeah.
Were you bruised after your surgery?
Yeah. I was bruised, mostly on the medial side, the inside of my knee. And, but so I had a 1 week post-op visit where I saw the physician's assistant, and she said, well, I can tell that you're elevating really good because my bruising went from my knee up toward my groin because I kept my leg elevated really good, because apparently, I mean, obviously, if your leg's gonna be down, that bruising's gonna run down, and mine wasn't. But yeah, it was bruised.
Just some around the tourniquet. as
Yes,
well,
I
where
did
the
have a little
tourniquet
bit
was.
around where the tourniquet was as well. What about you? Did you have any problems with the tourniquet?
What do you mean a tourniquet?
Did you have a tourniquet, or do you know?
I don't know.
See, I didn't know either, but
I don't know
up at the
During-
top of the thigh during surgery, most surgeons put a tourniquet on you, and so that you don't bleed out, and so that they can do what they need to do, so that so they kind of cut off all that blood supply to your knee while they're doing surgery. And so many people have had permanent damage from the tourniquet, but a lot of times what that tourniquet does is just it really makes it hard for the quad to wake up after that. And, of course, can cause bruising, can cause nerve damage. A lot of problems can happen from the tourniquet. I mean, I didn't have anything that was long term, but yeah. And that's another thing that a lot of people don't even know if there's a tourniquet.
How did you know you had one?
I think I knew well, first of all, I realized I was really sore up there, just up really high on my thigh. But then I had joined that Facebook group and people were talking about the tourniquet. And it seems like that's where I figured it out. And so I asked about it at my post-op visit. And I was told, yeah, that I'd had a tourniquet. So another one of those things that they don't tell you about in the class.
Right. So, we didn't talk about the type of surgery I had. So I had what's called the Mako, MAKO,
Okay.
robotic striker surgery.
Okay.
So, in addition to the MRI, they did a bunch of CAT scans. Did you have a lot of CAT scans done?
I didn't. I've been asked that before, and no, I had an MRI
You had the MRI
before surgery,
yeah.
and that's it. And I think that I think is what he used in surgery for the robot or whatever.
So with the CAT scan, they go in, and it was really interesting. I've never had this before. They take pictures all up and down your leg, all up and down your leg and your feet and your ankles and your knee and your all the bones, and they tape your legs together. They get you positioned the way they want you, and then they duct tape your legs together so you don't move. And they take a whole series of shots, quick little shots. They give that to the surgeon, and he can pull it up on a screen and practice the surgery on my knee. Kind of virtually.
Oh, interesting.
So it's up on a screen, and he can kind of see, what he needs to do when he gets in there for real.
Interesting.
You know what else I didn't know, and he told me this, is that, so they get all the measurements so that they know the sizing of the, the caps to put on.
Right.
And the size of the cartilage, the little
Right.
implants.
The hardware, yeah.
Yeah, with a little plastic thing that goes between the hardware, the replacing your meniscus. So there's a person called a prostheticist that is on site. He said they're not in the room during most of the surgery. They're only called in at the end. By all of these measurements, they pretty much know the size of the prosthetic that they want to have. But she's there with she or he is there with a whole case of different prosthetics.
Open up a case and choose which one you like.
Yes. May I show you?
Like the Bachelor.
It's like choosing a ring or something.
Yeah. Wow.
Interesting. See, I don't know how that went in my surgery. I know mine was robotic assisted and quadriceps sparing, and it was the subvastus approach where the incision is more toward the side of the kneecap. So instead of, my surgeon did tell me, instead of making the incision and flipping the kneecap all the way over to get it out of the way, they go in from the side and they just kind of lift it up and do the work from there. And at my first appointment, I asked the physician's assistant, I mentioned how sore the inside of my knee joint is, the inside of my leg is. And she said, well, she said, you've got the incision here. She said, but what you don't see is the internal incision that goes down along the joint where we open it up. Okay, that's enough.
Didn't know about that either.
Yeah. Yeah. And so there, just a lot of pain from there. But, I mean, I've heard people call it a barbaric surgery and a brutal surgery. And I agree. I mean, because they're cutting through everything to get in there and open it up. So, it's no wonder that it takes such a long time, but, to recover from. But, your 10 weeks, which is just really early into a very long recovery. I don't know about you, but I was told 12 to 18 months. And, so when you consider, being 10 weeks, that's really early. I mean, I'm 6 months and I'm glad I have these first 6 months behind me. But at the same time, I mean, I'm not there yet, and my knee feels like it's not there yet. It still reminds me that it's a knee replacement.
I felt for weeks and weeks and weeks that every morning was like Groundhog's Day.
Yeah.
I felt during the day, I've done my best, I've done my exercises. Look at this, I think I got maybe one more degree. I really can't tell on the knee bend. I'm working this. I went for a little walk. I'm, doing this thing. And in the morning, like, day one out of the hospital.
Yeah. Yeah. No, I get it. What did you, if anything, what did you do to try to help with your sleep? Were you able to do anything to help with the sleeping issue? And how are you doing now at 10 weeks?
I did a lot of things. I did, I haven't written down, I did, cognitive tasks where I would try to just, anything, counting numbers, big numbers, listing the states in alphabetical order and then in reverse alphabetical order, just breathing, relaxation, mindfulness, music, rain, water, ocean sounds. I even looked up, the different wavelengths of sound, or whatever the sound waves, I guess, like 528. Music is supposed to be therapeutic, and I started listening to that stuff. I tried melatonin. I tried gummies. I got to the point, because I'm just going days, it feels like, without sleeping, and it's different than not sleeping during other times.
Yeah.
Like during your work day or during your, normal day activity, if you miss a night of sleep, you're wasted the next day. It's like it's like it changed my brain waves. I felt like I need a reset. I need something where they can just go, how they shock your heart. It's like somebody just needs to go shock my brain and get these brain waves back in, because it's like I'm in a steady brain wave and I'm not having the fluctuations that would allow me to get to sleep.
Uh-huh.
It was at 5 or 6 weeks, I yawned. It's like, oh my God, I yawned. I must be tired. I hadn't even yawned. So, last night I had like a 4-hour stretch of sleep, and then I went back to sleep.
Nice.
For about an hour and a half. That's huge.
Yeah, that's good.
So the past 2 nights, I've had some sleep. Before that, it was still 2 hours. But 1 to 2 hours be the norm.
Yeah. Are you able to get into a comfortable position?
You know, the first 4 weeks or so, you're just so, flat on your back. I had so much swelling in my hamstrings and quadriceps. I mean, just
Oh,
one
wow.
distance. They were painful. But you really can't get on your side because it just puts pressure on either side, kind of the surgical
Yeah.
sites and the weight of your own body on the
Right.
mattress. And then I had that dadgum sensitivity to the cheek.
Oh, yeah, true. Because I know my physician's assistant, she told me, because my physical therapist told me I needed to be sleeping flat on my back with my leg completely straight and elevated. And that was so uncomfortable and it hurt my hip so bad. And I did that for quite a while. And then I think it was even at 6 weeks, because I think it was when we met with Sherry
Yeah.
that I said something about sleep, because I still wasn't sleeping good. And I asked her, I said, how long do I have to sleep flat on my back? And she said, why are you sleeping
Don't.
flat on your back? And I said, well, she said, who told you to do that? And I said, my physical therapist. She said, no. She said, the most important thing throughout this is sleep. She said, we want you to sleep however you can. And if it means your leg is bent all night long, so be it. In the morning, we'll work on straightening it again. And so, I literally had to practice sleeping on my side. And of course, it's obviously I put a pillow, under, it's easier for me with my left leg. I'm more comfortable on my right side, and then a pillow, and then that left leg is laying on that pillow, and I'm really comfortable. But probably only for about the last, I would say, month, and I'm 6 months right now, month, maybe 6 weeks. I sleep a 4-hour stretch. I can pretty much count on a 4-hour stretch, and then I wake up, and then a 2-hour stretch and a 2-hour stretch, and then I'm done. But the last few nights, I've done 2 4-hour stretches. And that's better than I was doing before surgery. So
Good job.
Yeah,
I'm pretty happy about that.
I know. And it just changes your whole attitude.
It does, and it will get better. It will get better. It just takes a while, and takes being patient. So, well, was there anything else that you feel like we didn't cover that you wanted to cover?
Yeah, maybe some of the unexpected things. One of the big things was just the breakdown between the brain and the body,
Mhm.
the biomechanics. So I could be there and tell my brain, okay, lift your leg. I think one of the things that people need to know is that when you get home, you can't lift your leg.
Yeah. Yeah.
You're doing everything you can, but that leg is not coming off the bed. I don't know if that was true for you, but I had to have somebody, go under my ankle and lift my.
I know it was a struggle, because Dee always put an ice pack under my knee, because the back of my knee hurt so bad. So there was always an ice pack under and an ice pack over. So I had to lift to get that ice pack under. And at first, you lifted it for me. And then finally, I know I was pretty proud of myself when I was able to just go, oh, look, I got my leg up.
They got me off the walker after 2 weeks. They wanted me off the walker and on a cane. So I did that, but I would get stuck, like coming into the house just over that little threshold, that little lip of a threshold.
Yeah.
It's like I can't get in the house. I'm stuck outside.
It's like a wall. I know.
It's like I just can't get in. And you have to. It's like relearning how to walk. I didn't know that. The little lip of a driveway, that little slope at a driveway. It's like a black diamond ski slope.
Yeah.
It's like, oh my God, run down and fall.
Yeah, it's amazing. And yeah, you're right. Those are unexpected things that you just don't realize, because getting into the shower was horrific. It's crazy.
Words to get into the shower. I've had a lot of hair loss.
Really?
Just coming out in clumps and handfuls. Yes.
Well, I was told by a hairstylist years ago that hair loss often comes from a traumatic situation, a very stressful traumatic situation. And sometimes the notice the loss for a few months after the situation happened. And
Yes.
I would consider this a very traumatic, stressful situation. So
One of the medical students who attended me when I was in the hospital, there were all kinds of people, but she said, she was doing research on pain from measuring pain from people who had had some sort of orthopedic surgery, and that the total knee replacement was the highest pain level surgery out there.
I would agree with that.
So
I would absolutely. I mean, just like, I had 4 babies and I never had an epidural with any of my babies. And I would rather have a baby than go through the pain of knee replacement again.
my God, that's
It's over faster,
It's over faster and you have a cute baby at the end of it.
right?
they get it. Some additional equipment that I would recommend people get are a long handle shoehorn, because it's so hard to drop your foot into your shoe and
True.
you can't bend there, it just kind of dangles on your foot if you do so with that one of those really long handle shoehorns, the blanket lifter, the ace bandage. I use vitamin E on my incision. I don't know if you do that.
I got that bio oil that was recommended, and so I used the bio oil for a while. I still I massage my knee most evenings with what's it called, healing ointment or something I got on Amazon, and it's mostly frankincense essential oil. I don't know if it does any good or not, but I like it.
Yeah, I'm not going to have very much of a scar at all. Even at 10 weeks, it's like, wow, part of it's almost completely healed.
That's fantastic. Now, see, I'm 6 months, and I mean, I think once mine is all faded, it's not going to be noticeable. But I still have a lot of color in my incision, and I was told that means it's still healing. So, I guess I'm just a slow healer.
Did yours get warm or hot?
Every now and then, yeah. Actually, just the other day, I think it might have been the day I went to the valley and I'd been in the car a lot, and I put my hand on it. I was like, oh yeah, it feels warm. It feels warm today. But because I check that a lot, and so I like it when I just feel it and it just feels the same temperature as the other knee. I'm like, okay,
Yes,
that's good. Things are calming down. So,
one other thing that my surgeon did, or that their practice does, for post-operative care. So they set you up with like a third party. It's actually an online kind of recovery course. So it's called Force Therapeutics. I think it has to be prescribed by the doctor, but it's free. They don't charge Medicare. They don't charge their insurance. But you may have to have access through the physician.
uh-huh.
But it's a daily record. You can go in there and log in daily your exercises. At first, I didn't like it because I didn't have the cognitive mental capacity to engage with the computer. It's like, give me a piece of paper. They mark this off, but I don't want to click and go over here. But I did a lot of them. Then when I started going to therapy, I compared the two. I found that what I was doing in physical therapy very much lined up, almost 100% or 90% with these exercises that were online. They have you set your goals, measure your goal, report your pain level. So I think that was a good resource.
That is.
I kind of like that, and they send
nice.
you little, and then they have your different exercises. Phase 1, phase 2, phase 3, phase 4, phase 5, and then you're on a maintenance. So I'm actually at the maintenance level now.
Gotcha.
But actually increasing those exercises. If you didn't go to physical therapy, how did you know how to stair step your exercises?
Lots of YouTube, lots of physical therapists on YouTube. And then who I landed on is Dr. Samantha Smith, PT. She has a YouTube channel, and all she does is physical therapy for knee replacement. And I really liked her. I liked her approach. And then she has courses that she, sells. And so I took her strengthening and balance course. And it's a 4-week course, and you got lifetime access. You buy it, it's lifetime access, and then you could just keep repeating it. So I did that 4-week course, and you couldn't start that. You had to be 2 months before you could start that. And so I started doing that, and I noticed so much progress after doing that because I felt confident when she was telling me to stand on my surgical leg and lift up my other leg and balance. I felt confident that she knows what she's talking about, and it's okay if I do that, you know, or to just like do it by myself or whatever. I would worry, but I really felt a lot of progress doing that first course. And then by the time that one was over, of course, she emailed me and said, "Hey, we have level 2," and I thought, okay, I want to try level 2, so I got that one. And so level 2, it's a 4-week course. And there's 3 workouts a week, and I'm actually still doing that one. I just repeat it as soon as I finish week 4. I go back and I start. I don't do level 1 anymore. I stick to the level 2 one, and I love it. As a matter of fact, I have to do it today. I haven't done it yet today, but that's my workout. I do her class 3 days a week, and then on the other 3 days, I walk and ride my recumbent bike every day, and then I do her class 3 days a week, and then the other 3 days I do an upper body workout, and I do just a glute workout because I know how important the glutes are for the knees and strengthening those glutes. So and working out, you know, I still call it PT, but really I'm just working out, you know, and that's going to be a part of my life for the rest of my life. And I figure if anything good came out of this, besides not having bone on bone pain anymore, it's that I'm working out every day. And I plan to do that forever because my arthritis pain and my bone on bone I just stopped doing anything. I was not doing anything at all. So I'm glad to be able to be active again and, you know, strengthen myself and my bones and everything. And I'm sure you're very excited and looking forward to getting back to pickleball.
It's a long ways down the road.
But you'll get there.
Yes. I also found Dr. Samantha.
Yeah.
And I was so relieved to find her. I love her approach. I love the pace that she does, that she's doing it with you.
Yes, I love that.
My gosh, it was such a relief to me to find her. It was about week 7.5 or 8, so it's just kind of recently that I found that. But through that online course that I was set up with from the doctor, they had those videos too, which had the exercises, and they demonstrated how to do it, and then there was a printout of how to do it. So it's showing you to stand on your surgical leg, do this, and then they have examples. But that's all about her.
Yeah, it's been real interesting since I did her first course. And that first 4-week course, the classes were like 45 minutes long. And I was like, you know, it was fine. I mean, it's 45 minutes. But the second week, or the second level, because they're a little more advanced, they're only 30-minute classes, you know. And I'm just amazed. I can tell every time I start the whole thing over, now what I'm doing is I'm doing the modifications for more advanced each time I do it. And it's just really made a difference. So yeah, super happy with it. But well, Gail, we are so happy that you took some time out of your day today to visit with us. It's been really nice visiting with you. We really appreciate you sharing your story with us and with our audience, because I know that your story is going to help a lot of people out there that are doing what you and I did. They're searching YouTube and they're looking for answers. Is there something that you would tell somebody right now that's out there searching and they're thinking about having knee replacement? What advice would you give them?
Really give it careful consideration and really work through physical therapy first. If there's any way that this can be remediated and you can have a level of functional use of your leg and your knee without doing the surgery, trying to go down that route. And I feel like I did that because I did that in February. It wasn't enough for me. And I knew that there were things that I wanted to do in my life that I didn't want to be as I was.
Right.
Like I'm too restricted this, and I'm not having a level of functionality that I want. I can't walk up hills. I can't walk that far from my house without getting stuck and needing to be rescued. You need support. Understand that you need somebody 24 hours a day.
Yeah.
Son said one comment that he made was that people need to understand, the patient and the caregiver need to understand that you have to be patient. Mm-hmm. There's no hurry up in this. He said for the caregiver, understand that at least the first 3 days, they're really not in their right mind.
It's true.
Yeah, it's just really difficult. So, be very patient with that. I wasn't sleeping, and I was up a lot, and he would not let me be up by myself. So I would just call him and pack him up, so he didn't sleep either.
Right. Well, it sounds like he was a wonderful caregiver. That's awesome.
And then my brother came, and equally. So I'm not sure. I'm not at the point where this is the best decision I've ever made in my life yet.
I'm not either. I'm just taking it one day at a time.
But it's a decision I made. I'm sticking with it. And
right. And we'll get through it. We'll get through it.
Yes.
And as long as you get to the point, when you get to that point where the light at the end of you see the light at the end of the tunnel, and it no longer is a train coming at you, that's a good sign. That's when you've turned a corner. So
thank you.
Well, Gail, thank you so much for being here today and for visiting with us. We really appreciate it. And I wish you the very best in your recovery. And I hope that you will keep us posted on how you're doing.
Thank you. And I want to, again, just thank you for hosting your recovery journey, because that made such an impact for me. That's, I think, you and Dr. Samantha, and then some of those other physical therapy videos that I watched were just so meaningful to me and helped me through those rough times.
Thank you. I appreciate that. And that really means a lot. And I'm very glad that you found value in that. So, all right. Thank you, Gail.
Thank you.
Right.
Bye-bye.
Bye-bye.
So ended up in the hospital.
Wow, can you believe that? That sounded rough.
Sounded like they were.
That was
yeah.
Like
when she said they were going to, I'm like, put you in a coma, because it sounds like everything is crashing.
Right? Yeah. And that's the thing. Like she was saying, there's no expectation of that.
Yeah.
Nowhere did the doctor say, now it's possible that all your organs are going to crash and you're going to have to go to the hospital. I mean, nobody, yeah, same. Yeah. I hadn't heard that before. So, that's scary, and so great of her son and her brother to come and help her out. That's fantastic. 'Cause again, I don't know how people do it alone, but I mean, it sounds like she's doing good. She's 10 weeks, and that sensitivity thing though, I mean, I guess I really count my blessings the more people we talk to, when I hear the things that some of these people have dealt with, and I didn't. And I'm just like so thankful that, I didn't deal with, these certain things. So,
I mean, you got to lay and watch a lot of TV.
Oh, yeah. TV was my lifesaver.
Yeah.
It was my lifesaver.
You couldn't read, but it was just, couldn't concentrate. Not.
Yeah. Yeah. I needed something to take my mind away, so. Anyways, but yeah, she was great, and I know that she'll get back to pickleball one day and be happy to have her knee back and her life back, but getting through it, that's the tough part.
She mentioned, this channel helped her a lot, and I know her video is going to help a lot of people.
Yeah.
And you could be part of that too if you've got a knee story, or if you've been through this. Good, bad, caregiver, we want to talk to you about your total knee replacement surgery, whether you've had 1, 2. I'm assuming nobody's had 3, not at the same time.
Not 3 different knees, anyways, but
right.
Maybe no, and not 3 at the same time. But I know there are people that have had to have the same knee done again.
Yeah. So we want to help you share your story and your recovery. Get a hold of us at hello@totalkneetalk.com. And we will make it happen. If you don't want to be on video, that's okay. We can do the audio.
Why wouldn't you want to be on video? I mean,
Right.
And you don't have to put on makeup. You don't have to get dressed up. I suppose you don't have to wear pants. I mean, nobody.
I'm not wearing pants. I'm wearing pants.
He's wearing shorts.
And if you if you don't want to be on video, if you don't have a story to tell, if you're just here hanging out, give us a thumbs up and hit that subscribe button so when the next one comes out. Actually, you have to hit the notification bell.
Yeah.
to do it. The subscribe helps us a lot.
Then you'll get notified when a new video comes out. But subscribe helps us.
The bell helps you.
It helps us because it tells YouTube that people want to see this kind of video.
Yeah.
People like this. And so, there's a lot of people out there looking for this video, or for these kind of videos. So by you liking it, giving it the thumbs up, that helps other people to find it. So
And it's all free.
it's all free. Yeah. It's free. So anyways.
Yeah. So it would help a lot of people out. And if you are going through this, we're here to support you. Just cut yourself some slack, give yourself some grace.
Remember, everybody heals differently. And this is your recovery.
Let's talk knees, titanium knees. From hurting to healing, to taking the lead. Let's talk knees. So next time someone brings up knees, don't just nod, lean in with ease. There's a saga in those joints, a battle fought, a new way to move, a lesson taught. Full range in 6 months, that's the move. Let's talk knees, yeah, knees.